Hello. For those of you who are new to the show, my name is Talaya Dendy, and I am the host of Navigating Cancer Together. It is the show that has something for everyone facing cancer. Why? Because everyone is different with different needs, beliefs, and perspectives. Thank you so much for joining us for this very special episode. I encourage you to open your minds and your hearts. For this special episode, we are going to take a break from the norm. This is a very special episode participating in Podcasthon, and you are going to have the opportunity to learn all about a wonderful organization called C.H.L.M.S Medi-Helpz. Sit back, relax, listen to the short intro, and then we will get on with the show. After you finish listening to this episode, please be so kind to share it with someone who may benefit from the information that is shared. I am so excited to share with you that Navigating Cancer Together is taking part in Podcasthon. It is a groundbreaking nonprofit initiative that is taking place from March 15th to March 21st. That is where myself and other podcasters are uniting for impact. About 1,500 or more of us will come together to raise awareness for charities of our choice. I am featuring C.H.L.M.S Medi-Helpz. And please be sure to tune into a very special episode of Navigating Cancer Together, where I will be talking with the fabulous Sandra Washington. She is the founder of C.H.L.M.S Medi-Helpz, and C.H.L.M.S Medi-Helpz is your partner for ensuring the best health outcomes for communities in need. So please make sure to check out that episode. You will not be disappointed. I would really love for you to learn more about C.H.L.M.S Medi-Helpz and all the wonderful work that they are doing to ensure that underserved communities are getting the support that they need. In the meantime, visit podcasthon.org to learn more about this very important initiative. And then while you're there, be sure to look up Navigating Cancer Together so you can see what we're up to and you can learn all about C.H.L.M.S Medi-Helpz until you hear from Sandra herself. So be sure to tune in to Navigating Cancer Together for a very special episode on Wednesday, March 19th. Sandra, thank you so much for joining us today and welcome.
Thank you for having me. I'm so appreciative of it.
It's my pleasure. I'm excited, Sandra, for the audience to learn all about your organization, C.H.L.M.S Medi-Helpz Foundation. First of all, Sandra, before we really get into what it is you do, the organization, tell us what the acronym C.H.L.M.S stands for.
Thank you so much for asking. My grandparents would love you for this. So C.H.L.M.S is an acronym. The C is for Christopher. Christopher was my maternal grandmother. The H is for Henrietta. Henrietta was my paternal, she still is. She's the paternal grandmother. The L, both of them actually had as their middle name Louise. So I'm not sure if when they were born, and I haven't done the research on it, I may do the research on it to find out why women born during the time that they were born, why they either had the first name of Louise or the middle name of Louise. But both of them were about the same age. They've since passed on, but they both had Louise as their middle name. So Henrietta Louise and Christopher Louise. The M is for my mother-in-law, who without her, I wouldn't have my awesome husband.
Wonderful.
My ride or die. He wouldn't have been born if it wasn't for her. And her name was Mary. The M stands for Mary. So the S, of course, is for me.
Okay.
So I did that because I wanted to always keep in mind whose shoulders I was standing on, who led the way and paved the way for me to be able to do the things that I have done in my life and that I'm going to continue to do in my life. Without them, it wouldn't be possible. That's what CHARM stands for.
C.H.L.M.S. Okay. And Medi-Helpz. How did you come up with the name? What inspired you to create the organization? We understand the acronym. Does Medi-Helpz have any significant importance or meaning to you?
Yes. So what Medi-Helpz means is just that, medical help. And the reason why it's a Z on the end instead of the S, and this is a lesson for all of those who listen. The reason why it's a Z instead of an S is because I started Medi-Helpz. The for-profit side of Medi-Helpz was started, I want to say maybe about 8 or 9 years ago. And when I started Medi-Helpz, I didn't pay for the domain.
Oh. Mm-hmm.
So someone came right behind me and stole the domain and tried to sell it to me.
Yeah. You're like, no
For about
thanks.
$4,000.
4,000.
Yeah, it costs a lot when you have a name. If you do not automatically buy that domain and you have it out there and it's not purchased, there are people that actually go and buy those domains and try to sell them back. So I was like, okay, well, I'm not going to give you $4,000 for this domain, so I'll change it, and I added the Z. So that's actually what Medi-Help stands for, because when I initially started Medi-Helpz as the for-profit arm, it was basically to do patient advocacy work and do public speaking. So what occurred with that was that I found myself turning away of people that needed help the most. Business is business. These are my prices. A lot of people that will come to me or call me because they heard my name and they knew what work I was doing, I would have to turn them away. I would never turn them away and not give them information. I would give them something to go on, but I wouldn't help them as much because, once again, business, business.
Mm-hmm.
And so sitting down one day, me and my husband were talking, and I was like, there's got to be a way for me to be able to help the most, not so much the most people, but help the people that need it the most.
Yeah.
Right. So I said, why don't I incorporate a nonprofit into a for-profit arm? So doing that allowed me to actually be able to do exactly what I did, which was birth C.H.L.M.S. So C.H.L.M.S sits under the Medi-Helpz umbrella. And so it allows me to do both. I'm in the process now of rebranding C.H.L.M.S. I'm not rebranding C.H.L.M.S, but rebranding Medi-Helpz, because when I did Medi-Helpz, initially, I wasn't an author. I've since have 5 books that I've written. So it makes more sense for me to do the bulk of the work where it incorporates talking to people, working with people, helping people with the resources and the research, to do that under the nonprofit arm, and then break the book business off and do the book business under the for-profit arm, because then I can actually use what I sell as far as the books, and actually whatever I sell go into the nonprofit arm. So I'm looking to pretty much set it up now as a social enterprise, instead of having the 2 companies do a social enterprise, but do it as a nonprofit.
Wonderful. Sounds like a great idea. And thank you so much for sharing that information, Sandra. What I really want to know is, you mentioned standing on the shoulders of your loved ones. What inspired you to create this organization? What was your inspiration? I know you mentioned wanting to serve people that did not have the means to pay for your patient advocacy support, but was there another reason that inspired you?
Basically, it was them, as well as I have 2 sisters. They're going to always be my sisters. One of my sisters, which was my oldest sister, she lost her life to a battle that she had a very rare form of heart disease. At the time that she was diagnosed with this heart disease, and she was as healthy, the old saying, healthy as an ox.
Mm-hmm, mm-hmm.
Well, she was as healthy as an ox. And it just so happened she woke up one day and she was in pain, and she went to her doctor. One thing led to another. But what occurred was she was finally diagnosed with a very, really rare heart condition. Part of her being diagnosed late in the stages was the fact that she was not going to a specialist. She wasn't going to a heart doctor. She was going to a geriatric doctor. She was 54 years old,
Mm.
and she was going to a geriatric doctor. When they caught it, they immediately hospitalized her. But because of the stage that they hospitalized her in, no other doctor would touch her, like as far as treating her, because they knew, my opinion is they knew what was going on, and they knew we can't help her. And if we get involved in this is going to be our, medical malpractice lawsuit. So we couldn't find a doctor to actually see her. She came home from the hospital. She had been home for maybe about 6 months. And they finally called me because I live in Chicago. My family is on the East Coast. They finally called me and told me what was going on. And I immediately jumped into it. So I called her health insurance company, and I had to fight with her health insurance company for a good 4 or 5 months, because what they were doing was they was going onto the internet and they were taking the information in reference to this disease off of the internet.
Wow.
And I found that out, one, because I am an advocate. So when you tell me things, I'm going to ask you where you're getting this information from, especially if it's something that's rare. So what I found out was they was getting the information in reference to who could be helped, what the condition is. And what a lot of people don't realize, Talaya, is this. When you're dealing with insurance, I don't care what kind of insurance it is, when you get to a certain age and you have certain conditions, it's looked at, okay, well, what is her quality of life? Is it really worth us spending millions of dollars to get this woman healed or get this man healed when they're going to turn around and not be here too long anyway? So what is it? And I hate to say it because I have to have these conversations with people all the time. A lot of times, unless you go to a doctor that's a good doctor and that cares about you, you're going to get caught in that system of you're too old for us to help anyway. So why are we going out our way for this? I finally reached the medical director of her health insurance plan. I had a couple of conversations with him, with that doctor. After the third conversation, he decided, well, okay, we'll go ahead and do the surgery. She died on the operating table. My niece and nephew drove her to Boston, where she went to Mayo Clinic to have the surgery done. And she died on the operating table.
Oh, wow.
The other incident that really drew me even closer into the type of work that I do is I have another sister who passed away. She had developed lumps up underneath her arm, and her doctor told her that it was menopause and sent her on her way.
Wow.
It didn't get any better. She was finally diagnosed with breast cancer. So she had to have the breast cancer surgery. She had that surgery, but the cancer had spread.
Yeah.
So when she passed away, but once again at a young age, when she passed away, she had breast cancer, but ovarian cancer was her primary. Yes.
Wow.
So at the time that she passed away, which was like maybe 6 or 7 years ago, there wasn't a huge amount of information known about ovarian cancer other than it kills, and it kills fast. And so we, as a family, we couldn't go, get her any help. And I, like, once again, with me living in Chicago and my family east, I didn't really get a chance to see them all that much. So I would guide them over the phone to, what should happen and what we should be doing to, help her out. A couple of times she was thinking about going to Memorial Sloan Kettering to have services done, but by that time she had become much too sick to do anything for us to get her any help. And so with those two incidences alone, I felt it my responsibility, because I know our community. I went to school for public policy and healthcare. That was my major. I got my master's in public policy administration. When I went to my undergrad, I went for healthcare. So I knew from studying, I knew, because I am it, that our community is hurting. And while people are speaking, there's not a lot of people speaking. We can speak. I can speak for you, but I'm determined to use CH.L.M.S to teach patients to speak for themselves. If you don't understand something, ask a question. Stop having that white coat syndrome. It's not going to get any better if you don't use your voice. So that's what drew me into the work that I do and drew me even further into the work that I do.
That's very powerful, Sandra. Thank you so much for sharing those stories because they're very informative, but they're also very traumatic. And I'm sure a lot of people out there listening have possibly had similar experiences. And so to know that someone like you out there exists who understands what that looks like, how to navigate the system, I think is really important. You mentioned something just now about using your voice. Why do you believe patients should be engaged in their own healthcare journeys?
Because nobody can speak for the patient but the patient. Like with my sisters, I could look at them, both of them, and I could say, well, I think this is what's hurting them. But I don't know. Only you know. You can go to the doctor's office and tell a doctor a story, and the doctor's sitting there calculating what he or she is going to tell you, which you might not be in agreement with. So why would you allow someone else to talk for you? I'm sure people may have, situations where they're like, well, this is why I would do this. Right?
Yeah.
But really thinking, like, this is your life. You only get one. I tell people all the time, something happens to me. Don't be trying to bring me back. Don't be freezing me.
You're like, it's just time.
Yeah, don't be freezing me, burning my eggs. Don't be doing none of that. Let me go. Let me go.
You're
Right?
burying my eggs.
Right? So because I don't want you doing that, right? I want you to be engaged. As we look at the world today and all the idiosyncrasies that's going on with us, around us, who would want to come back?
Right.
Right? I mean, I'm sure there are some people that might say, well, I want to come back because I want to, yeah, I'm not trying to come back.
You
So
know,
because I'm not trying to come back, I think it's important for me to take a control of my own healthcare journey and say yes, no, or maybe. And I encourage all patients to do that. You don't feel comfortable with the doctor, tell them, I don't feel comfortable with that. Let's start changing words that are in healthcare from nouns into verbs.
mm,
Patient-centered care is not a noun, it's a verb. It's something, it's a process that's done. Let's stop using it and saying, okay, well, patient-centered care or, patient centricity or patient experience. Those words are all good and they mean a lot, but let's start showing patients what they are, what they really are. They're not nouns, they're verbs. They were never designed to be a noun,
mm.
even though that's how they're used right now is as a noun because you'll see it written down, but it's not happening. So let's do your part. I encourage all patients do their part to ensure that those nouns that they keep throwing out, they become verbs because that's what they're designed to do is become verbs.
I love that, Sandra. Thank you so much for really bringing that home because you do have the power. You're your best advocate. You are the expert on you. So you have to, as you say, use your voice and show up for yourself. It's a blessing that we can laugh about it because some people won't even talk about death.
Right.
But I really like how you brought a realistic experience into this and saying, hey, I want to be able to say, this is what I want to happen to me when I pass away. Don't bring me back. So, those are different ways that you can use your voice as well. And you're using your voice while you're here, but you're speaking when you're gone too, because you've shared that information. You've got those documents in place that clearly state what you want to happen when you no longer can speak for yourself or if you pass away. So, all excellent points, Sandra.
Yeah, and I just want to add something as well. Is when I say use your voice, some of us speak and we use our voice, but like you just pointed out, Talaya, some of us write and we use our voice. This is the thing though, when you write, make sure you're leaving your writing somewhere where your close loved ones can get a hold of it. Make sure you're writing what you need to write. You're writing your trust. You're writing your will. And when it comes down to power of attorney forms are only good as long as that person is a living. Once that person passes away, all the forms in the world, other than your trust and your will, are not going to help you to be able to leave your family but leave your family in good hands and leave your family knowing what it is that you want. Do a funeral declaration form. Make sure they know, when I pass away, I don't want to be buried. I want to be cremated, so that your final thoughts and your final wishes are in fact being carried out.
Great point. Thank you for explaining the differences in some of those forms because some people may not be aware. Sandra, how has your work impacted your perspective on life and the world?
Well, as far as on life, how the work has been done and how it's impacted me, most definitely positive. I love hearing, when you go and you say, well, Sandra, you do so much. How do you eliminate that burnout because you're doing so much? And I eliminate that burnout by taking a look back at all the people that I've helped, all the people that my foundation has helped. How have we helped them? To see them sending me letters or texting me and saying, oh, Sandra, thank you so much for helping me. I didn't know this, or I didn't know this resources this did, and it actually puts a fire into me that if this one person out here received help, so does everyone else. There's a lot of other people out here that would need the same kind of help and the same kind of assistance. So it definitely impacts me on a positive level. It makes me raise who Sandra is from 100% to 110%. None of us are perfect, but I'm going to sure try to get you to be as perfect as you possibly can. What your perfect look like is different than what my perfect looks like. But on a positive level, let's push it there and get it there. So that's, my impact and my personal impact. And on life, it's there. It allows me to continue to build that legacy. That's what I'm looking for, that legacy. Working in corporate America for such a long time in the same field for such a long time. Excellent, Sandra. But at the end of the day, who knows you did all that work?
Good point.
Sees you? Like,
Yeah.
like really, like who sees you? Who knows that you did all that work? It's excellent work, but who knows it, right? So on a world level, yeah, it's legacy building. It's definitely legacy, and it's a positive legacy building because it's impacted so many people in such a positive way.
Yeah, I agree. And great work on all the wonderful things that you've done over the years. I've seen some of the impacts that you're making, and I just want to applaud you. Keep doing what you're doing with
Well, thank
Chalms.
you.
Yeah. The next thing I want to ask you, Sandra, because I know there have been many challenges. Can you describe the most significant challenges you faced in establishing and running C.H.L.M.S Medi-Helpz Foundation?
Most certainly. The most significant challenge that I face is that I'm a patient myself. So there are days and there are times that I want to stop. And I see the mountain in front of me, and I'm like, how can I move that mountain when I can't even move myself? Right? When I'm stuck. When I, for whatever reason, I'm diabetic. I'm also a CKD, which is chronic kidney disease. I'm also a chronic kidney disease patient. So there are days and times that I look and I'm like, I can't move. I can't lift my head up. I can't do this. I can't do that. And so it becomes a challenge. Sandra, you could do this. You can get up. You could keep going. Just keep moving. Just do it a little slower. A lot of times when I'm coming across issues that I'm asked to work on, and their emergent issues, it puts me in an even bigger challenge because then I have to take an even bigger breath and hold on and hopefully hold on and hopefully stay awake
Mhm.
while I deal with those issues. I thank my board members who came on, and we can't pay them right now. As far as the foundation cannot pay them right now because we don't have the financial capability of doing it, but they cared enough and they saw what I was doing and they saw what I was going through, and so they was like, yeah, we'll go on, we'll help as long as we can to make sure you get to where you need to get to, because the work you're doing is definitely work that needs to be done. So that's my biggest challenge, is overcoming the illnesses and the sicknesses, the days that I feel like I can't go on.
Mhm.
And look, Talaya, I told God, I
Mhm.
ain't doing this. I'm
Mm.
tired.
Mm-hmm.
And he says, watch this, because this
Yes.
ain't your work. This is my work that you're doing. So
Yes.
watch me move this. And
So,
so
yes.
he'll move it out of my way, and I'm able to overcome those challenges because my spirituality kicks up another notch or two to allow me to overcome those challenges.
I love that too, because a lot of times people think it only involves money, it only involves resources. But I truly believe you have to have that spiritual connection to do work in this space because it can be very taxing on someone like you who is really advocating and supporting others in addition to taking care of your own health.
Yeah, it definitely can be. And there are definitely days that Sandra isn't Sandra. And,
Mhm.
I've spoken to you about this before. And when I have those days, I also have those days that are Sandra days. Like, don't bother me. Don't ask me nothing.
Yes.
I'm not doing it. I'm doing what Sandra wants to do. Got it?
Mhm.
I so encourage everyone to have those days where whether you have kids or have somebody watch your kids, even if you got to pay a couple of dollars for somebody to watch them, have somebody watch your children. If you're alone, go to the movies by yourself. Do something that you really like doing by yourself. Make that day all about you. Honor you, right? So when those challenges come up, a lot of times I find myself doing a Sandra day where I'm not going to do anything. I don't feel like doing that. I pay for it, but
Mhm.
that's
Mhm.
okay. I'm able to enjoy my day.
That's right. And you got to have that balance too. You
Right.
work hard, you get to play hard too, and you have to take care of yourself to be able to keep showing up for others. So I love that you are at that point where you have Sandra days and don't compromise on those days.
No, for sure, for sure. Those days are not compromisable days.
Mhm. Sandra, you touched on this a little bit when you mentioned how you love to hear people share how you've helped them with their health and move forward through the healthcare system. Are there any other rewarding aspects of your work with C.H.L.M.S Medi-Helpz Foundation that you want to speak to?
Most definitely. That networking collaboration part that allows me to get in and know people, know what they're doing, help them out as well. Like, let's put our heads together. We can't move this system in a sustainable way if each of us is on our own doing what we want to do. We have to come together. We have to collaborate. We have to work together. This is not about competition. As a matter of fact, when someone tells me that they're doing something and they ask me to do something, and I'm looking at, okay, what is it that you want me to do? And I'm looking at you as a person or your organization and seeing where you are. If I see that competitive nature, I won't do it. There's so many people out here that need that. Why would I be in competition with you? If each of us in the healthcare field took one patient, each of us, there will still be billions of other patients that needed help. So why not come together, put our minds together and say, okay, well, you do this and you do this. So how is this going to work so that the patient comes out with a win-win situation? Because at the end of the day, as my t-shirts and my hoodies say, patients are the key. So
Mhm.
we got to keep that in mind, and it's helpful for us to keep that in mind overall together versus apart. So that's the other aspect that I really look forward to with Charms and with the foundation is getting in there and knowing who else is out here doing what we're doing or not doing what we're doing, but they want to. What can I do? What can I do to help them get where they need to go? Right. So yeah, that network and collaboration is a big part of who Charms Medi-Helpz is.
I can speak to that on a personal level. I mean, you've supported me in the work that I'm doing in several different ways, and we show up for each other. That's what I really appreciate about knowing you and knowing the work that you're doing. And you are a genuine person, Sandra. So I think that really makes a world of difference as well in you being able to reach so many people because people want to be able to connect with and trust and know that the person that they're coming to and saying, I need your help with my health, help me get on the right track. They want to know that you genuinely care about them and you care about people, Sandra, and their success and what they're trying to achieve. I could not go any further without acknowledging that. And that is one thing that I can definitely attest to, Sandra. I appreciate the help that you've given to me in the support. So I'm thanking you right here, giving you your flowers.
And you know what? And when I help people, and this is the thing about me, when I help people, I don't ask for money. People say, "Sandra, you should be getting paid for this." Why? I mean, there are certain things that, yes, I should be getting paid for, but why am I chasing money? I'm not chasing money. Money will come if you're genuine and you're sincere. It might take you a minute or two longer to get the money that you need to move forward, but it will definitely come if you don't chase it. If you chase it, you're causing yourself problems. So why go about and why chase it? So when I help people, and I see this with you, I see this with other people that I have mentored and I have worked with, the only thing that I ever ask of anyone, pay it forward.
Mhm.
If someone comes to you and they need your help, and it's something that, I'm going to refer you to this person because they will be able to help you, and they go to you and you tell them, well, I'm busy, or I can help you for $500, even $1. That doesn't sit well with me, because when you came to me and I helped you, I didn't ask you for money. I asked you to pay it forward. So as long as I can see that, and I'm so grateful to know you, because I see you doing it, all the time. I see some of the other young women that I actually have mentored and worked with. I see them out here making it and doing, paying it forward. And I'm like, yes, that's what I'm talking about. So I'll continue to help people like that.
Wonderful. Thank you for all you do, Sandra. My next question for you is, what are your long-term goals and aspirations for C.H.L.M.S Medi-Helpz Foundation?
My long-term goals are to, one, continue to write books in reference to healthcare. So I right now have 5 books, and all of them tie into healthcare in one way or another. It's important for me to keep putting those books out there, and I should have another 2 coming up in 2025. But the important for me is to have those books out there, because you go to a seminar, you listen, you hear, you go home, and so you say, I remember that. Yeah, that was a good one. Well, what did you learn? You have nothing to show. Or something happens where you need to have the information at your fingertips, but the person or wherever you were didn't have information for you to take away like that. And a lot of times when you go to places, they may have information available on that hospital or that particular health system or whatever, but you need an overall, like, let's generalize it and help as many people as we possibly can. So to continue to be an author is one of my goals. The second one of my goals, and I'm working on this as we speak, is actually launching a digital health platform that covers health literacy. So the courses that we're working on, we have the courses in line. We're doing some stuff behind the scenes with some people to actually, if we don't get a full grant, we'll do something similar to a sub-grantee to get the program out there. We just want to get the information out there. Our community is hurting because they don't know. They really don't. They have no idea what a specialist is. Like, why would I go there? They don't know that, okay, if you have a really long word, the doctor's giving you a really long word. If you know the prefix and the suffix, you could pretty much figure out what the root word is, right?
Right.
So
Yes.
instead of you going to Dr. Google and scaring yourself half to death because
Mhm.
Dr. Google is putting all kinds of things out there, you need to know for yourself. What is this that I'm talking about? So that when you go to the doctor, you could say, hey, this is what I have. Can you send me to a specialist that specializes in this? Instead of going to a traditional doctor who that's not their expertise is. So that health literacy piece means a lot to me, because I've seen way too many people go get Dr. Google. This is a thing. I can go to Dr. Google. You can go to Dr. Google and know, okay, well, this is a legitimate site or it's not a legitimate site. But
Mhm.
90% of the population, especially when we look at the under-resourced and the underserved, cannot do that.
Mm.
So me having a digital platform, the digital courses where people can take and know what they're doing in the healthcare field, that's another one of my goals.
Yes, I think that's critical, Sandra, because you're right. So many people don't understand the language. And if
Right.
you don't understand the language, you have to have someone with you who does, or you're going to just really be going through a lot of unnecessary challenges. So it's so important to understand the language. And I look forward to seeing that digital platform come to life and come out into the forefront and help so many people. What kind of impact do you hope to achieve in the future? I know you just mentioned the digital platform. Is there any other kind of impact that you hope to achieve in the future?
I would like to look up in, a year or two
Mhm.
and see the patient's voice rising. I would like to see like a massive onslaught of patients coming together and doing what they need to do in order to get their voices heard. I would love to see that, like a patient uprising led by who else other than the patient. And so it's really important that I put this out there. When I say the patient, I'm not just talking about the person who is actively sick. I'm talking about that person that's actively sick, as well as that internal support network they have, as well as that external support network that they have. So, whoever it is that's working with the patient on behalf of the patient, they're all considered a part of that patient network.
Mhm.
So that's what I say an uprising. And each person, each sector of that uprising doing what they need to do to make sure that patients, I've said this all the time when it comes down to CHLMS, our mission statement is that all patients should have access to optimal healthcare. That's important. That word optimal, meaning the best, is really important. You can go down the street to Dr. Jones, nice office, good neighborhood. But what kind of service is he giving you? How do you feel when you leave there? Are all your questions answered, or do you know how to get all your questions answered? If no, you're not getting optimal health care. Who does that hurt? It hurts the patient, hurts the doctor, it hurts society as a whole. So we need to be sure that everyone has access to. And I put the emphasis on access to because all patients are not going to take advantage of that access. That's fine,
True.
but you need to have that option on whether you want to accept it or whether you want to continue to get substandard care. We're not about forcing you to do anything, but you need to know that there's an option out there.
So important. Having options is a blessing because many people don't have options or they don't know what their options are. Now,
Exactly.
now, Sandra, someone has just received some very bad news about their health and they're wondering what to do. They're afraid. They don't have much family and they don't know very much about the healthcare system or how to advocate for themselves. What would you say to them?
Well, before I said anything to them, I would empathetically listen. And that empathy is hearing and it's listening. The listening is just as important as that hearing and that speaking empathetically, right? So if you listen empathetically, you can pick up on clue words or key words that they're saying that allows you to actually say, okay, mentally, let me make a note of this so that I can go back and I could check with them and I could say, well, yeah, I understand that you're thinking you're alone or you're feeling like you're alone, but let me share with you some resources about what's out there, right? If you want me to go with you to one of the meetings or, see how it is to check it out, let me know. I'll meet you there. If I know the person really well, I'll even pick them up and take them there. But I don't want you to feel like you're alone. None of us are really alone. We just don't know where to tap into. So let me help you tap in by unraveling what you just told me and getting you some additional assistance. 95% of the time, it works.
Thank you for sharing that, Sandra. And I love the way that you started that. Before you say anything, listen. And I think that's so important. More people need to know about C.H.L.M.S Medi-Helpz. Sandra, tell them where they can find out more about you, the organization, your team, the books that you have to offer.
You can find me on everything but X.
Okay.
Hey, I'm being honest. I'm not on X. I'm not on
Mhm.
Twitter. I haven't been on Twitter for a very, very long time. And that was my personal decision, and that was a choice that I made, and that's a choice that I decided to stick with. I am currently on Facebook. I'm currently on LinkedIn, on Facebook, on Instagram. We've just launched our Medi-Helpz professional page, and that was an issue because I had about 3 or 4 pages going on because while I was growing and when I first came into doing what I'm doing, everybody wants to help you and they want to charge you, but they want to also take advantage of you. So I had some unfortunate things that happened that I lived through. I lived to tell about, I lived to share information on it, but we now have someone that's actually working to build our brand on YouTube on our professional channel. So, that should be done no later than the end of March. But that's the places that they can actually check me out on. The other place that they can do is our website. Our website is www.medi-helpz, and Medi-Helpz is Medi-Helpz. There are a number of things that are on the Medi-Helpz.com website. We have our about us. We have our board members, who they are, what they do. We have our events page, which will actually give you an insight about what type of work we've been doing and how we've been doing it, and introducing you to some of the other smaller, lesser known nonprofits that we've collaborated with in the past by doing videos and letting people know that we're here. We want you to know we're here because some of them are as small as we were when we started, and nobody knows that they're there. So that's my way of making sure that their names get out there into the public. So we have that. We have our shop where you can go to find our books, and we also have a t-shirt and hoodie line. Patients are the key, hoodie line and t-shirt. We also have our newsletters. We release a newsletter once a month. Normally, we release it at the beginning of the month. This month, with it being January and it being a political season, we split January up. So we released one January 1st, which talked about things that patients can expect, such as deductibles, carryovers, information that they need to know, what they need to look out for. January being accounts receivable time, so you're probably going to get a whole lot of bills that you shouldn't be getting.
That's a whole nother conversation.
Right. So we did two. And so we'll actually release another one more than likely on the 30th of the month, which will cover the top 5. It's normally 4 or 5. It'll cover the top 4 or 5 issues that we're looking at now that the new administration is entered. And there's one really important one that we need people to be aware of. They're actually all, but there's one really important one that we need people to be aware of that the Supreme Court is considering right now. So there's our newsletters there. So it's a bunch of information, a wealth of knowledge is sitting on our website for people. And if they want to be involved in it, if they send me their email address, and I will make sure they actually get added to the newsletter list so that they can get the newsletter. And then finally, my email address is Sandra@C.H.L.M.S Foundation. So that's C.H.L.M.S foundation.com. You can send me an email and say, hey, Sandra, I heard you, would like to talk some more about you, want to know if you would come out and talk to my organization or church or wherever, because I do public speaking. So that will be a way for you to be able to see what's on my schedule and if there's something that we can make happen.
Wonderful. Thank you for sharing all of that information, Sandra. And I will make sure that I have it in the show notes for anyone who is interested. As we wrap up, Sandra, is there anything that you want to share that you have not had an opportunity to share?
I do. I want to leave everyone with this thought. Very often people ask me, why do I help patients? What's in it for me? Right? And I have to explain to them, I help you. You might say you're healthy, but I help you. There are three classes of patients in every last one of us, even our babies, fall into one of these categories. So you're either going to be a proactive patient, meaning that you're taking care of all of your things in case another emergency like the pandemic, because we're going to have another one. So making sure you got all your eggs in a row, your T's crossed, your I's dotted, so that should something happen, you're like, oh, I'm already set for that. What's next, right? And you can continue to live your life without stress. Then we have the active patient. Those are the people who, like me, have been diagnosed with a condition. We see a doctor on a regular, whether it's a holistic doctor or whether it's a traditional, what's classified as a traditional doctor. And sometimes, like me, we see both to help us. We're active patients. We need to know what's going on now, because what's going on now impacts us now, right? And then we have the retroactive patient. I'm hoping that if you're listening to this, you don't fall into a retroactive patient mode. Even if you have a baby at home, don't fall into the retroactive patient. And a retroactive patient is they wait until something happens and then they say, let me see if I can get some help. Then they go on Dr. Google and get information from the wrong people. Then they sit at home and they stress and they cry and they're all torn up because they didn't do what they should have done when they should have done it. So please, if you're listening, try to stay out of that retroactive. Babies are retroactive patients because they really can't speak for themselves. However, the parents, the grandparents, godparents, aunties and uncles, whoever is an adult in that child's life, you can step up and you can make sure that that baby is listed under the proactive patient group because their shots are taken, they need help. Who's their primary care doctor? They need specialists. Who's their special? All that information is kept somewhere where somebody can get to it should an emergency arise. So yes, I hope all of you listening are fall into one of those categories.
That is such important information, Sandra. Thank you for clearly defining those different kinds of patients. It's helpful to know which one you are. And if you are in the retroactive, get the support, get the help that you need to move into the other categories because, like Sandra said, that's not where you really want to be. Thank you, Sandra, so much.
Yeah.
I I have a call to action for anyone out there listening. Please take a moment to visit Medi-Helpz.com to learn more about the impactful work that Sandra and her team is doing to support underserved communities and support their causes. Is so important. So check out Medi-Helpz.com. And as I mentioned, I will have that information in the show notes. Sandra, I must thank you again so much for joining us for this very special episode for Podcasthon. I appreciate all the information that you've shared and the wisdom that you've shared today, Sandra. Thank you.
Thank you so much for having me. I truly enjoyed it. And thank you so much for thinking so highly of Medi-Helpz. And when you had the opportunity to use, like, I know exactly who I want to be able to support through this initiative, and you chose our organization. We thank you. And on behalf of the patients that we service, they thank you as well, because without your help, they couldn't get the help that we're able to give.
It's my pleasure, Sandra, and keep doing all the wonderful work that you're doing. I want to thank everyone out there listening for joining us for this special episode of Navigating Cancer Together. Visit podcasthon.org. That's spelled PODCASTHON.org to discover hundreds of other associations through the voices and the work of all the amazing podcasters out there. Also, like I do all the time, before we end, I'd like to give a shout out to the Navigating Cancer Together community and valued listeners. Thank you so much for joining us. That is it for this Wednesday. And until next time, let's keep navigating cancer together. Take care.